So welcome. Again, my name is David Mandel. I am the Executive Director of the Safer Together Institute. We'll be together till about 20 after 3. Happy to walk you through this idea of addressing complex and intersecting issues, domestic violence, substance abuse, and mental health, and when those issues meet. And if you're not familiar with the Safer Together Institute, we are a US-based organization that specializes on training and consultation, organizational assessment related to the intersection of domestic violence and children. And we do work in the US and abroad to really help sustain a global network of domestic violence informed child welfare professionals. And that's a group that's broadly defined, so it's not just ODGFS type professionals, but it includes the therapists, the counselors, the programs, the foster families, the courts that all touch families that are focused on the basic safety and well-being needs of children, and the communities and systems that are around them. And so we work in many of these places that you see here, and I'm going to try to keep my picture out of the way in case it's in the way. Just to give you a broad feeling of sort of the scope of the work, we work in the US, Canada, the UK, we've done some work in Asia, Australia, very frequently New Zealand, and our work in Ohio, just to highlight it for a moment, has been a great collaboration between ODVN, the Ohio Supreme Court, FILA, and other members of the IPV collaborative. And many of you there have gotten training from certified trainers that we have trained to deliver our model and to bring it to you throughout Ohio's 88 counties. And so we're really excited to be adding this webinar on intersections to what's being received, because what we're finding in many, many places is that the top 3 issues that are being faced by families that are engaged with child welfare systems is domestic violence, substance abuse, and mental health. And one of the things that we hear is that people will use languaging in their local context to really talk about the toxic trio or the trifecta, triple threat, triple play. All these terms kind of have come up in our travels across jurisdictions, which really indicate that that really this is on the top of people's minds across the globe as we're working. And so we're really excited to be talking about this on this webinar today. Our organization is really about creating better outcomes for families and systems. You're going to hear about bits and pieces that really will help you think about competencies, how to strategies. Part of this webinar will be strategies to really help you think about how to work with families better, how to break down some of the silos that really exist in our practice and our thinking, to really help bring out a application of the model and its perpetrator pattern-based focus, which I'll summarize really briefly here for those of you who are not familiar with it, to really bring that perpetrator pattern-based approach to bear on these cases where it's maybe the domestic violence perpetrator who has mental health issues, maybe it's the survivor, the adult survivor, maybe it's substance abuse on the part of the survivor. And all these different configurations bring greater and greater complexity to the work. And so first I'm going to start with a quick review of the model and just kind of give you a feeling and start bridging the gap into intersections. And many of you on this call are very familiar with this visual aid, where really we summarize the principles of the model, and the name really refers to that first principle, which is that from a kid's point of view, from a child's point of view, that it's often, almost always, but not always in their best interest for us as professionals working with the family to see the benefit of trying to keep that child safe and together with a non-offending parent, the domestic violence survivor. And this is really critical to the entire model, which is the working assumption that lumping parents together using language that implies that it's both parents that have engaged in domestic violence or that the couple has a history of domestic violence, anything that obscures the differing roles related to domestic violence versus one being a person being a perpetrator, another being a survivor, that when we obscure those roles and those different situations, we actually make our job, around the children harder. And that we're often challenged in ways that we don't need to be, and that by shifting our clarity to see the ways that domestic violence survivors promote physical and emotional safety, help kids heal from trauma, and provide stability and nurturance, that we're really, if we're not using that framework, we're often making our work harder and making it harder for us to serve the children and families that we work with. And so what you're going to hear today is really some strategies that really bring forward this idea that even when a domestic violence survivor may have issues around substance abuse or mental health, that our assessment must consider their strategies or their ability to look at providing safety for the kids, helping the kids heal from trauma, and provide a stable and nurturing environment. One of the most basic takeaways from the research that we can consider is that a parent who has depression, for instance, or anxiety or PTSD, having those mental health conditions, whether in the response to being a victim of this particular partner or not, does not automatically incapacitate them from being a good and healthy parent. And that doesn't absolve us from doing an assessment of her safety strategies and efforts to promote the safety and well-being of their kids in the face of domestic violence. And similarly, in the face of substance use issues, that we have an absolute responsibility to be able to articulate specifically, even when a parent who's a victim of domestic violence has substance use issues, that how are those substance use issues impacting their ability to protect their kids, and to do a thorough and comprehensive assessment of the things they may be doing to keep their kids safe in the face of both their substance use and their partner's violence. And so one of the common mistakes that we make in practice is to equate having those issues, particularly when somebody's a domestic violence survivor, with an automatic inability to care for their kids. So keeping children safe and together with that non-offending parent is a top-level part of the model. Connected to that, and you can begin to see how this ties together, that partnering with that person should be our default position. And the way this is played out in practice is when I used to do consultation day in and day out for child welfare agencies, that I would often start with a worker to ask, well, what did you learn about what mom did to keep the kids safe? And if that worker was using a lens of, well, she didn't call the police, or she's not willing to go to a shelter, and that's kind of where their assessment stopped, I would guide them through some additional questions to help them identify the things that somebody's doing day in and day out to promote the children's well-being and safety, and to stabilize the family in the face of the perpetrator's violence. And so in the context of identifying these strengths, for instance, with substance abuse, you may actually have a domestic violence survivor who chooses to drink with the perpetrator because that's actually a safer choice in terms of managing the danger to themselves or their children. That drinking may be the safer choice, to actually go along with him, to acquiesce, or to placate him by drinking with him. Maybe one of her strategies actually to keep the kids safer than it would be if she said no and then didn't give him his beer or didn't drink with him. And these are things that we can find out through this partnering effort. So partnering is part of what we do in terms of the information gathering, how we reach out to her. And if there's time in this webinar, I will go through some of the steps around partnering that really are directly related to these complex cases. And then finally, intervening with perpetrators is a priority. And where systems have often been lacking is really intervening with perpetrators as parents. And so when we look at this intersection question, how do we intervene with perpetrators as parents who have substance use issues? How do we intervene with perpetrators as parents who have mental health issues? Adds a layer of complexity, including that they may be misdiagnosed. That it's not uncommon for domestic violence perpetrators to be diagnosed with bipolar disorder or other issues, and that those become the outward-facing face of his issues, and the domestic violence behavior recedes to the background. Not in a good way, but in a way that often is detrimental to the family. So when we look at interventions with perpetrators in this context, we want to be able to integrate the intersections into our work and think about what does it mean to engage a perpetrator who says, I don't remember what I did that was violent because I was drinking and I blacked out. And to have the ability to engage that person and say to them, okay, since you're claiming you don't remember what you did, do you have reason to dispute the story that the police are telling or that your partner's telling? And these are strategies of engagement and accountability that can be used to really work with somebody and to kind of challenge them around their own behavior in the context of this example, substance use and domestic violence perpetration. So that when we look at these systems that we work with, you know, in many cases there's a substance abuse court in many areas, and the question is how well are they handling domestic violence. When we're dealing with substance abuse programming, we're looking at how well we're really kind of addressing domestic violence in the context of substance use. So when we're talking about these issues, we'll be looking at the intersections that relate to intervening with perpetrators to reduce risk and harm to the children. The other key element of the model, and again, we cover these in depth in different trainings, is this idea that good, what we refer to as domestic violence informed practice, requires building off of these 5 pieces, and that if you don't have important information in each of these 5 boxes, that the quality of the work, the decision making, the assessments, the case planning is not going to be as good as it could be. And you really should be thinking about how well is my documentation really capturing these things. And so when we look at this really briefly in the context of intersections, you want to be thinking about, and we'll be talking more about, how does the perpetrator's pattern of coercive control of his partner intersect with the issues of substance use and mental health? So for instance, is he calling up child welfare and making false reports around her substance abuse as part of his efforts to control her? Is he actually trying to interfere with her recovery efforts? And so these are very common areas of intersection between coercive control and substance abuse. Is he taking actions to harm the kids? And that can be a variety of things, like interfering with their parent-child relationship, using the kids as a weapon. And so a very common thing would be using a survivor's mental health history, which may very well have been caused by his violence, to threaten to take the kids away from her. So again, we have this area we need to assess perpetrators, not only what they're doing to their partner, but what are they doing to harm the kids. So is he more likely to be violent, to physically abuse the kids when he's drinking or doing drugs, for instance? Can we answer those questions about how he may be harming the children by spending money that's allocated to rent or to housing or a mortgage, or has his substance issues caused him to lose a job? So when we think about these intersections and what perpetrators do to harm children, we're going to be exploring those as well throughout this webinar. When you get to the third critical component, we have this idea of what's the survivor doing to promote the safety and well-being of the children. And with here, you know, we really want to be considering even what somebody is, when somebody's having an addiction issue, or when somebody is having a mental health issue, still looking at what they're doing day to day to provide stability, nurturance. So for instance, you may have somebody who knows when they're going to start drinking or doing drugs, that they hand their kids off to a relative to be safe and to be away from the situation. What are they doing to maintain the routine of the household? And so these are the kind of things that we can be looking at, not just these common formal things like calling the police or getting a court order against them or leaving the relationship. Our strengths-based assessment needs to be more day-to-day as well. The fourth thing that we look at is really tying together what the perpetrator does with the harm to the kids, including family functioning. And so, for instance, and I'll give an example of this that is from one of the cases I worked on, which is the father of these kids, particularly one kid who had an anxiety disorder. He drank, and he also got violent. Now, oftentimes when he drank, he got violent, but not always. But what that meant for the child's anxiety is the child's anxiety spiked every time dad drank. So if you're looking for impact based solely on violence, you would have less of an understanding than if you said, what's the kid's experience of his father's behavior? What makes him afraid? What are the triggers of his anxiety? And what you would have found out if you looked at this case was that the kid's anxiety spiked based on his dad's drinking, not just his violence. So there were many more instances of anxiety being produced by this in this child, by the father's intersections of his drinking and his violence. And then the last thing is critical component of the model, and this is really what we're going to spend a lot of time on, is really this idea that substance use, mental health issues, culture, socioeconomic status, race, ethnicity, education, none of these things are causing domestic violence, but they need to be assessed as they intersect with coercive control, actions taken to harm the kid, survivor strengths and vulnerabilities. And so all those things are really critical. And again, this whole webinar is really focused on this area. So this is really important. So I'm going to kind of give you, I'm going to move my image because I don't know if it gets in the way of being able to see this. So what we found is we've been working on this issue, and we're working on it fairly intensely these days. We're doing a research project in Australia where we're looking at communities of practice as it relates to substance use, mental health, and domestic violence. We worked on a project recently in Florida. We're looking at how do you treat perpetrators or intervene with them related to substance abuse, mental health, if they have those issues. And so this is a really big area. We also just launched within the last couple of weeks our online course on intersection. So if you're interested in that, you're happy to reach out to us. And so really what we found is that it was really good to be able to look at these vignettes and to kind of make it concrete and very specific, to give people a feel of how layered and how many different angles you could look at this question of intersections. And so this is based on a real case example. John doesn't like that his wife, Shalita, works nights at the bar. After an argument before she left for work, John starts drinking hard liquor. Normally he drinks beer. Later that night, when she returns home, he punches her in the head 3 times, almost knocking her unconscious. Their 1-year-old child does not wake up during the assault. Talking about the incident later in his men's behavior change group or better intervention group, he admitted he drank hard liquor to give himself permission to get violent with her. And this is actually based on a client that I worked with years ago. And what it really brings out is the intersection of drinking or drugging and choice making. And I think one of the practice challenges often is that using drugs is often used as an excuse for certain behavior. And that we can often be manipulated into believing that because substances were involved, that the normal choice-making behavior is not happening or not relevant. And from a legal point of view, that's just not true. But from a social work point of view, we can be really caught into this idea that if drinking was involved or drugging was involved, one, we're going to have to accept his excuses. 2, that there's not actually identifiable choice points. And one of the choice points actually exists before the drinking and drugging even starts. And here's a classic example. And this client at the time was absolutely clear that he said he drank liquor in order to give himself permission to get violent. And so when we look at these conversations we may be having with perpetrators, we can't really let ourselves fall into the trap. There's another case that I was aware of where the man was out drinking during the day with friends, comes home, and demands the family car. There's one car, there's an infant in a car seat. Because his partner is being protective of him, of their scarce resource of the car, because it was a gift from a family member, that she says no. And so here I want you to just think through this parenting lens. One parent wants to take a car, put them and potentially disrupt the function of the family. Another parent saying, no, I don't want you to do that. That's unsafe. This is our only car. I don't want you to damage it because he's already intoxicated. So he starts assaulting her. And without going further into the assault, he starts assaulting her above the scalp line, starts hitting her. Why? Because the bruising won't show. And so this kind of behavior really belies this idea that automatically we should assume that when somebody's drinking or drugging, that they're not actually making choices, and therefore we can it means we can engage them about some of these things and ask them questions and understand there's actually a thought process that may be uncovered that really illuminates responsibility. The next vignette, same-sex couple. Angela's been violent to her partner Georgina for years. Recently, Georgina told her if she didn't get help, she would leave her. Surprisingly, Angela went to see a psychiatrist who diagnosed her with bipolar disorder and gave her medication. Over the next few years, her physical violence diminished but didn't stop. Over the next few months, her physical violence diminished but didn't stop. Her verbal abuse, unrealistic expectations of Georgina and their children, her absolute control over the finances, and the mood in the house didn't change. In fact, in many ways, it got worse. When Georgina or the children complained about Angela's behavior, she told them she had a disease, and her doctor said she needed and deserved the love and support and understanding of her family. She joined a bipolar support group because she needed to be around people who understood what she was going through. Neither the support group nor the psychiatrist addressed her violence, control, or abuse. And so what this example is really meant to bring out is this idea that medical and psychiatric and mental health diagnoses often do not specifically address the behaviors of violence. And that those of us who are involved with doing evaluations or using evaluation services really need to be aware that unless the violence and the pattern of violence is being specifically addressed, that a mental health diagnosis by itself may not actually address those behaviors. And even the treatment of that mental health issue may not address those behaviors. And here, what we have even is a further kind of extension of some of the issues, which is once that mental health diagnosis is given, it can be used as a shield by that perpetrator to avoid accountability. And so what we've seen in some cases is perpetrators using that diagnosis as an excuse for their behavior, as a way to redirect people, and as a way actually to manipulate their family and friends to ignore their violence and in fact accuse them of being unsupportive of their disease or their issue. And so again, you're seeing a completely different angle here than in the first story, the first vignette. One more written vignette before we actually I show you a video and we do a little bit of polling. Jackie started drinking when she was 14 and then smoking pot when she was 15. Now 22, she has 2 children from her previous relationship. She's pregnant with her boyfriend, Luis's child. Prior to getting pregnant, child protection became involved with Jackie when Jackie was pulled over for driving under the influence with her children in the car. Sober for the last few months, she's hopeful she's getting better. Luis keeps telling her he doesn't want to be raising no other man's kids, and those shits are too expensive. He smokes pot in the house, encouraging her to join him. Eventually, she gets high with him. He calls child protection to tell them she's using again, and they take her children. She's also worried that they'll take her baby when he is born. And again, this is derived from a number of real-life cases. And what you see here is, that we often are dealing with domestic violence survivors who do have prior issues with mental health or drinking or drugging. And that's important to acknowledge that when we're working with this, that not all issues are just she's medicating herself because of the violence, or that we're only looking at PTSD caused by the violence. We can have survivors who have attachment issues coming into the relationship, anxiety, depression, suicidality, other mental health issues, different levels of substance abuse, and that those things can be pre-existing, and that their partners will interact with them and maybe use those things against them. But that person is often at increased vulnerability. And so, for instance, substance users may have less natural familial supports. They may have abused those. They may have used those. They may have betrayed those. And so domestic violence survivors who have pre-existing substance issues may have greater vulnerabilities in the sense they have no natural supports from their family and kin. And so here you have an example where already involved with the child welfare system is a vulnerability, and now he uses that against her to get the kids from a prior relationship or prior relationships away from her, so he can get more attention for himself and his child with her. And so his pattern of behavior includes using her behaviors that are real, that are problematic for her and for her kids probably, to use them as a way to gain control over her. So these are some vignettes that to give you an idea of just how complex and how many different angles we can be looking at this issue from. And so I really wanted to give you, because we're going to talk about some general concepts in a few minutes after I show you another scene by video, but just wanted to give you a feel for this. So before I do that, I want to pull up the polls that we share, and I can't tell because we've never used this polling. Here we go. So you should be seeing the polling results. So again, it's just this is useful for me to see that it's a majority of folks on the call are child protection, and that we have other all these other fields except evaluators directly, but we've got some juvenile justice, probation, parole, just one person, but also some representation for substance use and mental health. So I just wanted people to see who was here on the call with you as we move forward. So I'm going to just drop this out here, and then I'm going to actually go back to my screen share. And so I'm going to show you this video with another case scenario. This is directly out of our intersections. We've created a number of online courses, really high quality, very interactive courses, and this is the last one. It's intersections where domestic violence, substance use, and mental health meet, and it uses different teaching methods. It's not a recorded webinar, and so this is one of the vignettes that's out of that online course. So I'm going to show this to you. It's about just under 2 minutes, and then I'll throw up a couple of poll questions for you to think about related to this.
Elena was a drug addict when she was a teenager. She got straight when she became pregnant with her daughter, Mary. Elena's been drug-free for 4 years. As a young single parent, she's worked hard to take good care of Mary. Mary attends a preschool program in her neighborhood. She's an active child who's looking forward to beginning swimming lessons at the Y this summer. Smokes marijuana regularly and pressures Elena to smoke with him. When she refuses, he becomes verbally abusive. He tells Elena that she's worthless and she'll never find anyone better than him. Trevor tells Mary that her mother is stupid and that she doesn't need to listen to her. He says Mary can stay up as late as she wants. Recently, Mary's become defiant. It's been difficult for Elena to put her to bed and even harder to get her up in the morning for preschool. Some days, Elena just doesn't have energy to argue with her, so she lets Mary stay home and watch TV. Last week, Elena just couldn't deal with Trevor's insults and threats anymore. She began smoking marijuana with him. This morning, while Mary was at preschool, Elena looked up her old dealer and spent the money she'd put aside for Mary's swimming lessons on OxyContin.
It should say what behaviors of Trevor's impacts Elena, Mary, and the function of the family. It looks like something kind of got messed up here. So take a look at this and just click. You get a multiple choice, so you can click on as many as you want. But just take a few minutes to see what you captured from that video, and we'll see what we do here. So you just kind of identifying what behaviors you heard in the video, not just what he might do, but what behaviors of Trevor impacted Elena, Mary, and the functioning of the family. And this is really critical to the safe and together model approach, is not to just talk about incidents of violence, but patterns and impact on family functioning. And you can select more than one answer. Absolutely. You're asking that, Jessica. So do not hesitate that there's more than one correct answer here. And so we're just trying to get a sense of what, what people saw. And so take a minute and just look at, I'm gonna close the poll in a minute. So just refer to it and think about what you listened to. Okay, so it looks like it's there we go. So share results. So you should be able to see the results here. And it's really, really important. And so when we're talking about this, the model, we refer to it as a perpetrator pattern-based approach. And here in the context of intersections, the scenario didn't describe him hitting Elena or physically abusing Mary in this scenario. Now, might that have happened at some point in the future? Absolutely. But it wasn't described in the scenario. What was really described are these dynamics that are extremely common. And so one of the things is, in our assessments of families that have domestic violence and substance issues, are we assessing for whether the perpetrator is coercing or pressuring his partner to engage in substance abuse activities, smoking drugs with him, and again, you can even have the level of involved with trafficking or sex work where somebody's being pimped out or coerced so they can having sex with other people, earning money so drugs can be bought for both of them. But really the question is, if we know there's a present domestic violence, or we're having conversations with somebody, that really our assessment needs to kind of include those kind of things. And that pressure could be of physical violence. It could be other kinds of threats. It could be verbal abuse, like was really done here, which was, you're worthless, and telling Mary not to listen to Elena. All these things were part of his pattern of non-physical coercion and abuse, and focusing stress on Elena in this scenario. And so I think when we look at our practice, we've got to consider are we looking for, and there's data that really shows that this is not uncommon for survivors to experience pressure around using drugs or coercion and interference with recovery. And we'll talk about that in a few minutes. So then the next poll is, I'm gonna go to poll 3, which is about the impact. So take a moment and look at this. And again, it's multiple choice, so you can answer more than one, but look for there's some incorrect answers in here, things that weren't covered in the video, but look to see what you think is the impact of Trevor's behavior on child and family functioning. And again, I really want you to make the distinction here that we need to be both talking about what the perpetrator engaged in and what was the impact. And part of the foundation of domestic violence informed practice in general, and as it relates to intersections, is, can you describe the perpetrator's pattern of behavior, specifically what they did, which was the prior poll was really to ask about that. But then can you talk about the ways it's affected his partner, the child, the function of the family in specificity? It's not enough to just say the function of the family's got harder or things are more difficult. But it's really important to kind of be specific that Trevor's behavior has led to Mary becoming more defiant. Trevor's saying to Mary, don't listen to your mother, you can stay up as late as you are. So that's the specific behavior. So Mary's behavioral issues and transition issues are not just a sign of difficulties in the family or even of mom's substance abuse or mom's stress. That dad's behavior, or Trevor, the boyfriend's behavior, is actually the source both of mom's stress and the difficulties in the transitions for Mary, and the difficulties that are now cropping up in the relationship between Mary and Elena. So I want people to really be thinking about are these things being captured in your documentation? And you probably know these things about families because of the work you're doing, but are they really being captured in the documentation and being really conveyed as decisions are being made that these kids are, or this case, Mary, if Mary was to go to a therapist, or there was going to be conversations about Mary in the daycare, or Mary's needs, if we didn't capture Trevor's behavior and connect them back to these difficult transitions, what would end up happening is it would be about Elena's inability to get the child to daycare. And you're absolutely, you've identified correctly, except for the Mary hitting Elena and other kids in daycare, that wasn't part of this. But Elena relapsing, Elena spending money that was for Mary's swim lessons, increased exhaustion and stress for Elena, difficult transitions to daycare, difficult bedtimes, all those things were being created by Trevor's behaviors. So again, I really want you to really be thinking. I think here we go. I didn't quite share that here. That I want you to really be thinking about these things and how is these things reflected in your documentation on the other cases that you're working on that have similar issues to this. So that's the end of this scenario. And I'm just going to check in with the chat here for a second because I really haven't had it open. And I want to see if if people have any questions. And the easiest thing for you to do, given that we're a large group, is to type them into the chat box. So I'm going to stop for a minute and take questions. And one is the first one with Galana Mitchell. With Trevor, not only is it his abuse verbally, is a level of control over his family, and absolutely that he's engaging in coercive control over the family, and that what we're talking about is this really pattern-based approach is actually designed to tie together through the pattern-based approach what Trevor's doing to Elena and Mary, and how the functioning is of the family is happening day to day. Another way to put it is, how is his behavior strengthening or weakening the function of the family? And so you could argue that he is increasing tension between mother and daughter. He's undermining their relationship. He's increasing stress levels for Elena because Mary's becoming harder to manage. He's increasing Mary's stress level because he's undermining Elena. He's creating a less nurturing, stable environment for Mary. And so all these things are flowing from his behavior and choices in this case. And so you can also look at how the family was functioning before he showed up. And it was clear indicators that it was functioning well based on what was in the video. So anyway, so yes, it's a level of control over the family, but it's not enough to say that. We need to really articulate what he's doing specifically to harm family functioning. Any other questions that people have right at this moment before I continue with the presentation? And again, you can type those in the text box, and we can try to pick it up. So doesn't look like more coming through right now. I'm going to go back to the presentation, and we'll keep moving forward here.
Elena,
so there we go. So I'm going to talk in some generalities for a little bit before I dive back down into practice. This is actually Ohio-based data. Ohio has a wonderful, really cutting-edge effort around needs assessment and identifying what's going on with families that are involved with the child welfare system, and which issues predominate and what combinations they happen in. And so you see here that similar levels of substance use, domestic violence, and adult mental illness occur, in a range, and that when there's domestic violence as a concern, the majority of those cases have intersections with mental health and substance use. So just speaking to the commonality of this. And Ohio did, created some 36 practice profiles at one point that really looked at different ways these things played out. And out of those 36, 18 of those practice profiles had domestic violence in them, which means that they were at a present list practice profiles at a much higher rate or higher rate than mental health and substance use were present in them. The other two bits of this slide really are about perpetrators and adult and child survivors, and just, there's different studies. They're looking at different populations. Some of the data is conflicting, but what it starts pulling out is that there isn't this one-to-one correlation between perpetration of domestic violence and either mental health issues or substance abuse. So again, one of the takeaways is you can't make any assumptions about these families. You can't make any assumptions around perpetrators. If he was arrested while he was drinking or doing drugs and he was violent around that arrest, it doesn't mean that automatically if he gets sober that the violence will stop. It doesn't mean that he's not violent also when he's not drinking or drugging. It doesn't mean that one preceded the other, or we know how they're connected. So really, again, one of the big takeaways is just to do a family by family pattern-based assessment to really look at how his drug use, say, for instance, and his mental health issues and his domestic violence kind of intersect. And again, I'll give you another example. Worked on a case where, or was involved with reviewing a case where he took the children. So here we have his instrumental use of the children, took them out of the home, called back to the mother, said, if you don't give me money to do meth, that was his drug of choice. If you don't give me money to do meth, you won't see the kids again. And so I think that really captures this idea that the relationship between substance abuse and domestic violence is a complex one. And one of the ways we have to assess families is, are perpetrators using their violence control to get money for drugs or to drink? And so that's why it's so important to really ask these kind of questions. What we also know is that domestic violence survivors have higher rates of mental health and substance use issues than non-survivors. And similarly for kids who are exposed to perpetrators' behavior. And so when we're looking at these things, we can tease out other things. For instance, not on the screen is that, women are more likely to be introduced to opioids, for instance, by male partners than men are. Men are more likely to get exposed to opioid use for the first time through friends. And so when you have this kind of issue of introduction of opioid use, to women, you have to look at it. That's happening in the context of coercive control, that hooking you on drugs give me a tremendous amount of control over you because you become more vulnerable vis-a-vis your rest of your support network. You're less likely to be believed. You may become dependent on me for getting your drugs. And so all these different things are really part and parcel of our understanding and our assessment of survivors. And again, these higher rates of mental health and substance use issues doesn't mean that she automatically should be assumed to not be able to parent. That's really important in the context of this kind of work that we're all doing. So where we've been. This is a really common statement that we see in case files and case presentations and court documents even. And what when I was doing case file reviews in child welfare, and I've been involved with the child welfare system for around 21 or 22 years around the issue of domestic violence and child protection. Oftentimes we would see this kind of languaging. The family has a history of domestic violence, substance use, and mental health. And it's a listing of these issues. They're co-occurring. And oftentimes judges have been presented with this as the only bit of information about the intersections. And we could pick this apart, but it doesn't tell us about risk and safety. It doesn't tell us about who has which issues. It doesn't tell us about how they intersect. For instance, how is the perpetrator leveraging his partner's substance use to gain more control over her? And so when we're documenting, we need to really move beyond this. When we're assessing, we need to move beyond this into a different approach. And so we need to break down the silos. And when we don't break down those silos between substance use, mental health, and domestic violence, these are some of the costs for that lack of intersectional work. And so perpetrators we don't hold them accountable. For instance, they can use substance use as a way to avoid accountability for their violence, or mental health issues as a way to avoid accountability for their violence. We don't support the full treatment and safety of adult survivors. And so, for instance, if you think about your community and where you are, what's the protocol if you're living in a rural area and there's only one local substance use program, about whether you're going to refer both the survivor and victim of domestic violence, the survivor and the perpetrator of domestic violence, to that same program? And is that program therefore going to be physically and emotionally safe for her? And if there is no protocol, is that going to interfere with her treatment and she's going to drop out? Worked on a case where the father interfered with the mother and child getting mental health treatment, and when he came back into the home, their counseling efforts stopped, and then the case note said mother and child have become resistant to counseling. No mention of his role. And so is that kind of languaging and that lack of assessing his impact going to strengthen her safety or our relationship with her, or interfere with it? Systems work efficiently and effectively, and if we're not really breaking down the silos, we may send somebody for mental health treatment and not really appreciate whether the perpetrator is undermining it. So while most of this presentation is about adult issues, think about a kid who is being treated for ADHD and is on Ritalin, and then he goes back to the house on the weekend of his father who's been abusive and controlling, and what he does is throw that medication out. And then the kid goes back to the other parent's house and is acting up. And so when we're not connecting those dots, and if the therapist for that child isn't aware of the course of control, then there can be less efficacy and efficiency. So we also know that if the silos aren't broken down, kids can remain in placement longer, cases can remain open longer because we're not diagnosing correctly and figuring things out. Case plans are less effective. So again, one of the big takeaways is if you've got a domestic violence survivor who is a substance abuser, and you're not assessing if the perpetrator has a pattern of interfering with her recovery efforts, and you're not planning out with her and thinking about, well, how might he interfere? Will he keep the car from you? Will he show up at your meetings? Will he make calls against you? And you're not assessing what you have in the case file, then you're more likely, to create an atmosphere where she may fail out of that treatment program more easily. We had a perpetrator in one case show up to his partner's inpatient program and demand she leave. And while he wasn't physically violent at the time, his ability to coerce her meant she left, either for her own safety, the safety of the staff. And again, the documentation was that she left against medical advice. So again, his accountability is invisible, not present. She's being held accountable for choices that are really being coerced and forced on her. This in turn may lead to unnecessary removals, and obviously if systems aren't responding well, there may be increased harm to children. I'm not going to spend much time on this in this webinar, but these are some, you'll get these slides afterwards, and these are really good questions to consider about silos in service delivery and about integration of services and, share information sharing. And so you see here a slide around perpetrators, similar questions to ask about survivors. So again, I hope that people will take this information and really sit down in your community and sit down in your agency, because sometimes these silos are within agencies, and say, well, we've got mental health services in our agency, we've got substance use service in our agency, we've got even domestic violence programming in our agency. What are they communicating with each other? And what information is shared, what coordination is going on, and what do we all need to know? What kind of protocols can we set up? Again, a child-centered example of this breakdown, consider a situation where a case is in children's court and child protection court, and it's domestic violence is going on, and there is a domestic violence consultant in the waiting room. There's the kid's therapist. They're both waiting to testify. The kid's therapist starts chatting with their colleague in the hallway. They don't know each other, and so they get introduced, and Oh, you're a domestic violence consultant. Why are you here? Oh, I'm working on this case, the Smith case. Oh, I'm here for the Smith case as well. But you're a domestic violence consultant. Why are you here? Well, because there's domestic violence in this family. And the therapist, and this again is a true story, the therapist says, I had no idea. And if I knew there was domestic violence, I would have treated this child completely differently. And so that to me is kind of this example of how when these cases are siloed across services and information is siloed, that really we can actually produce poor outcomes in treatment and decision making. So one of the key things I want to kind of offer up to you is this idea that we can really map out some of the ways that a perpetrator impacts survivors' issues. So again, talking about adult survivor. And so, what we know is that some survivors come into relationships where they end up being abused with no prior mental health history, with no prior substance use history, and that literally that the perpetrator's violence actually causes the anxiety, causes the depression, causes turning to alcohol and or other drugs to self-medicate, causes the post-traumatic stress disorder. And so when we really look at, again, if we just list these issues or list that there's domestic violence and mental health issues in the family, and we don't tell the story that says mom, prior to meeting her current partner, had no existing mental health issues. And then we really kind of begin to articulate and say, these are the behaviors he's engaged in, and this has been part of her response. We really are missing an opportunity if we're not doing that to really, one, hold them accountable, two, set up a scenario where we can help her in the best possible way. For instance, there was a case I worked on where the kids reported that dad was scary and mom was depressed and wouldn't get out of bed. And what I can say about the intervention that happened at that point was by good domestic violence informed practice, going in and working with her, partnering with her, her depression lifted. It was actually situational depression related to feeling trapped by his behavior. And when we rush to pathologize, we rush to diagnose, when we rush to kind of create a treatment plan for depression or anxiety or even substance use that doesn't really account for the perpetrator's history and pattern of behavior, we may be doing a disservice to the family and actually not working with them in the way that we need to work with them. The middle or the bottom slice of this is this idea that perpetrators exacerbate existing issues. And so Elena and Trevor is a perfect example that she had a prior substance use issue and that his showing up really exacerbates, leads to a relapse, engages her in those behaviors. So sometimes perpetrators will actually bring drugs into the house. They will engage in drug use themselves to really make it harder for that person to stay sober. So again, I want you to think about that one behavior. We're co-parenting together. I say I love my kids. I am being abusive to my partner. I'm accusing her of being a bad parent because she's using drugs. And so I do something to exacerbate her drug use instead of supporting her sobriety. And I think it's useful to try on for size. What do we really expect from a partner when they're going to be supportive of their partner's recovery? And to really look at perpetrators through the lens of maybe they're doing exactly the opposite of what they expect. Pick somebody up from a recovery program and actually drive them to a bar, which is again a real example. And so this idea that perpetrators are neutral, or if we just look at it as, oh, that's her problem to deal with, we really may miss the pattern of behavior where he's exacerbating her use. The third area is this idea of interfere with. Does he interfere with her recovery, her mental health treatment? And that could be any number of things: throwing out medication, verbally abusing her around her choice to go to a therapist. It could be myriad of things: threatening to use a mental health diagnosis against her in court if she chooses to leave him. It could be showing up at her AA or NA meeting. And I'm just giving you a smattering of some of the things that can be there, but that really this idea that we need to be assessing for all three of these things, really, when we're looking at the intersection of perpetrators' behavior and domestic violence survivors' issues. So again, I'm going to stop here for a second, and there's a lot of information, and I want to see if there is any questions or comments at this point, particularly about that last slide. You know, what would help you relate this back to your practice? And we've got a diverse group of folks here, and you know, please don't be shy about posting something in the chat box and asking a question. And as Dana was saying, we'll be getting you these PowerPoints after the webinar is over. So any questions, any comments? Feel free to identify what's most helpful about what I've been saying so far. You know, if you've never done one of these things, my experience, you know, is, you know, I'm sitting in a room and talking, and I can see myself, and I can see little boxes with people's names, and so it's always helpful to get some sort of written or verbal feedback. And as Kyle's saying, if somebody wants to ask a question, just again, I'll take a minute and handle any questions. You just unmute your phone or your computer and ask a question. You know, specific tools we actually don't have right now. And Kyle, you can correct me if I'm wrong. That right now there aren't any screening tools per se. If you took our, you know, intersections course, the online course, then that there would be more questions there, and it would give you a more in-depth dive into sort of how to think about this. It's important to understand the limitations of existing, you know, like for instance, substance use tools or mental health tools, which is that, like the MAST, which is a common sort of short screen for substance abuse. Those kind of things don't ask any questions about this at all. And so, no, we don't have within this workshop more detailed questions, but our online course does. The next question, what do you recommend in terms of services or a way to engage parents who have not yet acknowledged the danger that the offending parent poses? I think this is a really common question that goes on, that's bigger than just this intersections course. You know, I think in terms of, you know, in terms of the questions they ask, it really depends on, you know, the situation, your relationship with that parent. I mean, one of the most basic things we ask people to consider in their assessment of families is to ask questions about what male partners may be doing to strengthen or weaken the function of the family. And this is just a general question. And so, you know, so when you're talking about how to engage, you know, I'll just talk about moms for a moment, because I think a lot of times we're not engaging moms about their male partners if they're heterosexual. And you can just apply this out to primary caregivers in general, that we should be asking questions about to primary caregivers and say, well, what is your partner doing to support your relationship with the kids? How are they demonstrating to the kids that they respect your behavior, your parenting, your choices? That oftentimes general questioning about the other partner's behavior in the family can often lead to disclosure of domestic violence. Kind of the classic one is, you know, what does your partner do to show the kids that they respect you? And again, think about all these questions being very behavioral. This is not, these are not role questions. These are not, do you stay home and does your partner go to work? And, you know, it's really questions about, how does he do this, or how does she do this? And so, so if you have information about dangerousness or about partner's behavior, you know, that we should be able to approach somebody in this general family functioning kind of lens that can really be very helpful. And so that's just general advice that's really good for work across families. I'll take one last question and kind of and then move back to a couple more presentations. Remember, we're going to be ending probably close to 3:20 today. So Katie's saying, in a perfect world, what would be the specific best practice steps in addressing the case where the mom relapsed and spent this swim money? That was Elena, and was the mom, and Mary was the child, and Trevor was the boyfriend. Again, it's really hard to delineate every scenario or what the best practice steps, because it would depend on how you were involved, why you were involved with the family, what your prior relationship was, what you knew about the scenario. And so what I can say in terms of a general sense of things is if somebody you're working with or know was sober for a while and then relapsed, would talk about what changed. And if there was a new element being introduced, and here's the new element is the boyfriend, I would explore more about his role in the family, and does she feel supported by him? And again, this is really different than saying, well, is he abusing you? Because one, she may not label that as abuse, and two, it really doesn't get at the fact that her relationship with him may be complex. He may be supportive in some ways. He may be good to her in some ways. He may be good to Mary in some ways. We only showed one slice of that relationship. And so really, best practice is really understanding that male partners are often very important to moms and kids that we're working with, to focus on behaviors, to ask questions about behaviors, to really kind of engage her about exploring what his role might have been in her relapse, which doesn't make him responsible for a relapse, but really includes him in your assessment of the family. And I think there's, again, I'm giving really generic best practice steps, but we could go a little further, a little deeper if we had more specifics around our working relationship with the family. So good questions. So I'm going to go back and finish the last bits of the presentation. Again, I'm going to move my image here and just, and you'll see a few slides coming up that I'm going to skip over, because again, this is part of a larger presentation, and somehow this went backwards. Okay. So some practice considerations. I'm just going to give you a summary of some of these things, and is that we need to be assessing each family and individual, not just assume certain things in terms of the way these things relate. And again, I'm giving you very basic examples, which is don't assume that somebody who is a subusing victim of domestic violence can't parent their kids, and ask questions about her parenting behavior and her protective capacity. Consider each parent separately. Don't lump together perpetrator and survivor when we talk about mental health and substance use issues. And the example I always tell is about sitting in on a substance use treatment program planning conference for two parents who had substance use issues, and there was the worker presenting the case, and there's domestic violence in this family, and it's not that serious. And again, they're kind of lumping them together. Well, they both need substance use treatment, and there's domestic violence together in this family, but really that's not why we're here to talk about it. And I asked the question, well, since domestic violence isn't one size fits all, can you tell me a little about the details of the perpetrator's behavior? And without blinking an eyelash, she said, well, he tried to strangle mom. So I want you to just think from a substance use treatment lens. Why is that specific information so important? Well, you'd want to really be talking to the perpetrator about his behavior and how it intersects with his substance abuse and dangerousness, and know something about how dangerous it is. And so if his relapse may not be just a danger to himself, his relapse may mean he's just become more dangerous to her, that how can I manage safety or be engaged in questions about dangerousness if I'm a substance provider who doesn't know that he could be that dangerous to other people when he's using, for instance. And then similarly, on the survivor side, you can't strategize for safety. You can't strategize for how he might interfere with her recovery. We can't see what the relationship between his violence is and her using. And so if we lump them together, we really miss essential information. And so here you see that next recommendation: seek to understand the relationship between the perpetrator's behavior and the their pattern in the adult and child survivors' mental health and or substance use issues and treatment successes and values. And so you'd really want to know as you looked at somebody who was a domestic violence survivor, and they were in and out of treatment, to really ask the question: did your partner's behavior have any influence over you leaving treatment or going into treatment or anything like that? Particularly calls to child welfare, there may be very, critical piece to this, which is perpetrators may try to use child welfare against a partner who has a history of mental health issues or substance abuse. Disconnects in this area are huge. Worked on a case, was involved in a case where father engaged in severe violence, sexual assault, physical violence over hours to the mother with the children in the home present, ends up being incarcerated. Fast forward 6 months later, there's a call into child welfare. The kids acting up at daycare, throwing chairs, being aggressive to other kids. Mother seems to be very angry with the child, very judgmental, detached from her, blaming her. And so where family goes into the system, assessment happens. And at the end of the day, the assessment is made that the likely issue is attachment between mom and the child, that mom is not well attached to the child. Well, when you look at actually further evidence that was available at the time, the child is drawing pictures of the father who's incarcerated, and mother is saying that the child is acting just like violently, just like her father did. So in that case, his footprint, his continuing role in the family system is actually being ignored, and it's being reframed as this is just a mother-child issue versus a logical consequence of the severe violence that he put both of them through. And this is not only not domestic violence informed, it's not trauma informed. And so we really need to be looking at these things and considering these connections. So we need to be prepared for these complexities and ask more questions. We need to be prepared for more challenges partnering with a survivor. And that's kind of where I'm going to end primarily, and then expect more intervention challenges with the perpetrator. And you may feel like certain areas of this are getting attended to, but it's really such a huge area, and we're limited in this hour and half hour and 20 minute slot. So it seems like there's things that got jumped over here. Hold on one second. I'm just going to go back. Yeah, I don't know why certain things are not showing up on the PowerPoint, but let's see if, there we go. Let's see if I can get back here. So I'm going to do some quick Q&A right at the very end, but I think people will be interested in this context of practice around partnering with survivors in the context of substance use and mental health. And so we have this 6-step process that we teach in our core training around partnering with survivors, and it involves affirming that the perpetrator is 100% responsible for his own behavior and its impact on child and family functioning, that the survivor is not to blame for his choices, asking her about his pattern of behavior because she's a great source of information, assessing her strengths, including day-to-day behaviors, validating those strengths back to her, because oftentimes we're gathering that information about her strengths, but we're really not sharing it back with her. Then collaboratively planning based on this established relationship and trust, and then documenting all these things in a way that kind of keeps them alive as a case may move out of your hands. So when we look at this, each of these steps, and again, this is just sort of scratching the surface of it. Imagine whether you could say these things, or are saying these things to your domestic violence survivors who may have substance abuse issues or mental health issues, and hopefully you're ticking off these things as, yeah, I do this, I do this, I do this. And so your drinking is no excuse for his violence and abuse to you. So again, we're really suggesting in a domestic violence informed partnering practice that if we as professionals are engaging in this practice and we're affirming to a survivor in this situation, we actually need to know, are we saying these things and not leaving them up to her imagination? Are we saying when it's appropriate, your anxiety doesn't make him get abusive? You could substitute your drug use doesn't make him abusive. Perpetrators will use a mental health history or a childhood abuse history to justify their violence. So do we say to her, or to, well, in this case, I'm sorry, I'm picking up another example. Do we say to her, the fact that you were abused as a child actually doesn't justify him treating you poorly. So perpetrators may use her history against her. His violence abuse doesn't help you be sober. It even make it harder to be sober. So in fact, naming for her his interference with her sobriety or recovery, and really be able to help her separate out issues that she may see, that you may see, but also really kind of pulling them apart from the violence. And so, yes, your depression may be hard for the children, but that doesn't mean his violence isn't also hard for the children. So that's a bit about affirming. Asking, and again, these are questions that are designed to engage a survivor around her partner's behaviors and ask her some questions. And these are specific to the intersection of these issues. And so how has his behavior changed when he's using substances? Has he ever used abuse to get money for drugs or alcohol, or stop you from questioning him about his using? What's the children's reactions to him when he starts using? And so that example I gave earlier right there about the kid's anxiety would be right along this lines. Does he pressure, use drugs and drinking? Is something we should be asking. How does his substance use impact the function of the family, and how has his sobriety impacted it? We know some perpetrators actually, when they stop using drugs and alcohol actively, they actually can become more controlling or remain just as controlling. And that's why sometimes you'll have survivors saying, I liked you better when you were using. And that may sound counterintuitive, but what we find is that if he's focused on his drug use and not on trying to control her day-to-day behavior, there may be more freedom that she has in some ways, even if it's hurtful and harmful and destructive. So again, really understanding those patterns is really useful. And things like, this is not an end all, but how does he support or undermine your efforts to stay sober? Assessing, again, some sample questions about what do you do to manage the children and the function of the family on a day-to-day basis in the face of both his violence and his drinking. This is the strength-based assessment of her behavior. And here's a great kind of statement: knowing that most people in your position do a lot to shield their children from the effects of their partner's drinking and violence. Can you describe some of the ways you've been able to do this for your children? Then these are validation statements. And again, they're samples. And I see how hard you've been working to minimize the impact of his drinking on the kids by sending them to your mother's house on the weekend. It's amazing that given his violence and the chaos caused by his meth use, you've kept the children going to school every day. So again, each of your cases, these statements might look a little bit differently. I know you struggle with your own drinking, but it's clear from what you've shared with me that right now for you, drinking makes it easier to deal with the hurt and anger caused by his violence. And that you have a plan with your mom to make sure the kids are taken care of when you drink. You are still making sure your kids are taken care of despite his choice to expose them to violence and the pain it is causing you. So again, to really, people ask me, well, when is she responsible, for her behavior, and particularly if she's an addict or she's using? And I'd say actually this kind of languaging makes it easy to really kind of address her, because we want to say to her, your drinking is an excuse for him to get violent to you. Those kind of statements will help her focus on her drinking and not take responsibility for things that are not hers. So these things can be really clarifying and supportive at the same time that they're about holding him accountable. And then here's some questions about collaboratively planning. And a lot of these are general across a lot of domestic violence cases, but I'd love to point out, for instance, this planning can include action on our part as a practitioner. So if a mom has been kicked out of a substance program because of a partner's violence, he doesn't let her use the car, he shows up at the program and makes a scene, then maybe you can call up that program and advocate for her return. Or really look at, trying to help her with housing issues that may have been caused or exacerbated by the perpetrator of substance issues or violence. And the last thing, these are just, I'm not going to read them all off, but we wanted to provide you with examples of what good domestic violence informed documentation looks like. And so just depicts that middle one and read it. Alexa, despite her own struggles with alcohol, has engaged in a series of actions to protect her children from her father's violence when he's drinking, their father's violence when he's drinking heavily. This includes sending them to her mom's, keeping beer in the house, because he doesn't get violent when he drinks beer. That's another bit of understanding his pattern. And drinking with him, so he focuses verbal abuse on her and not the children. And so it's important, again, to look what this is capturing. It's not excusing his behavior, and it's not saying he's not harming the kids, but it's really identifying, in this particular sense, her strengths around her protective capacities, despite her own drinking and his drinking and violence. So if you were taking our online course, there's a much fuller version of this. We would go in depth around some advanced practice issues like perpetrators and suicidality, these kind of things about false allegations by perpetrators against survivors, which I don't have the time to go into, but I wanted you to see them as these possibilities. Okay. So I am gonna, just for those of you who want contact information, when you get this, you'll have access to ways to reach us on Twitter and Facebook. And I would encourage you, if you haven't done this already, to go to our website, safeandtogetherinstitute.com, and sign up for our newsletter, where that's just the general way to reach us. Also on YouTube, we have lots of videos that are available for free as well. So I'm gonna stop the sharing and just see if there are any last questions. Hopefully folks will, check out our website, check out, I don't know, Dana, if you want to put up the IPV Collaborative website. I think they should have that because they signed up, but Dana, you may want to put that up. Yeah, and I just saw somebody put a comment. If you want to take a minute and write a takeaway, for you, that would be great for me to see a takeaway. That's just something that you felt like a benefit you got from this, something that was useful. That would be really wonderful to kind of have in here. Thank you, Dana, for organizing this. And this will become available online through the IPV Collaborative website at some point. So if you have peers, colleagues who you weren't able to attend, they'll be able to access it. There's Dana saying the next webinar is on supervising domestic violence cases, and it's April 27th. So keep your eye out for registration on that. And thank you all very much for your time. I hope this really helped you work with families. Yeah, and anything you want, I'm going to just close out my video and my audio for a few, but if you want to keep writing takeaways, that would be great. So thank you all, and enjoy the rest of your week.